online, maybe people will. Thank you very much, Jack. Hopefully, other people will trickle in or catch it later online. Jack can be on the admission button. This one there, Frederick. Hi everyone, my name is Will Strong. I'm the one of the co-directors and chief executive of the Autonomy Institute. Autonomy does three things. We do policy and advocacy around work, welfare, and climate. Things like universal basic services, universal basic income, and also things like the shorter working week. All sorts of kind of more ambitious ideas for what the new economy could be. We do consultancy, where we help move organizations and change the kind of shop floor practice of organizations to bring the new economy forward. So kind of primarily moving companies to 4-day weeks or charities or other kinds of organizations, the public sector. And finally, we do kind of tech and data for progressive movements. So we help augment movements' capacities with our kind of tech and data team, the Autonomy Data Unit. Welcome to Forum 2029. If this is your first time at the forum, this is a space where we're bringing together experts, campaigners, politicians, other voices, trade unions, for example, to try and formulate what a robust living standards policy program actually looks like. This series, which runs from July through to, well, June through to September, is bringing together 40 different panelists of different kinds. And from each of these sessions, we are articulating a very specific set of policies, and I will be asking our panelists tonight for a policy suggestion to go into the pot. And we're going to be writing up a policy program in September for a live launch that's going to be happening in Bethnal Green in London. I'm sure we can all agree that the current government's direction of travel is not the right one, and that an effective program is really yet to emerge. I don't need to remind everyone that if the left does not produce this program, then people will look for answers elsewhere, particularly on the rising far right. And I also don't need to remind people of the growing challenges of our time, which really put pressure on us to try and get this program sorted, build consensus, and build that power to kind of back it. Good ideas on their own won't make change happen. I think we all know that. But nonetheless, it is important that we have a shared program which is ambitious enough to change this country, but also realistic enough and functional enough to really make it happen. This is the third of 7 events. We've started with the launch, which focused on housing, a second event which focused on food, energy, and water. This event is on public services, and we have a range of other ones. We have a couple more this side of August, or at least one more this side of August, and then there's a bunch more in September and lead up to towards the end of the month, kind of ending just before the Labour Party conference, actually. The full list can be found on our website, autonomy.work. But tonight we're talking about public services. How do we need to conceive of public services in our age of crisis and tumult? What specific policies do we need to rebuild our public services as an alternative to austerity, and not just to help people make do, but also to allow people to thrive? This is something which is quite close to Autonomy's heart. We run the UBS Hub, Universal Basic Services Hub, which is trying to reimagine public services, which can be free at the point of use and allow to kind of help rebuild that social fabric, but also find new ways so people can kind of exist in the world and not just to kind of meet basic needs, but allow people to kind of have that's what we call a fully capacitated life. Okay, so the format tonight is that there's going to be 3 speakers. Unfortunately, Luke Fletcher had to drop out for personal reasons. We wish him well. We have 3 speakers, 3 fantastic speakers tonight. There's going to be, well, after this introduction, we're going to go one by one. I'm going to introduce each speaker one by one. If you have questions, please put them in the chat, and we will get to them after all the speakers. So we're going to kind of let the speakers kind of say their piece, 10 to 15 minutes. Then there'll be questions, which I will chair. As you know, as you just heard, we're recording this session, so this will be uploaded online after this. And we are, as I say, we're going to be kind of extracting some of the ideas from this call, including those that come up in the questions. So you do have a chance to contribute and going to put them into a program, a report coming off the back of this Forum 2029 session. Right. Okay. After all that ramble, let's go straight into it. We're going to start with Jamie. Jamie Driscoll served as the Metro Mayor of the North Tyne Combined Authority from 2019 to 2024. He is now leader of Majority, a new organisation that exists to rebuild our democratic institutions to serve the interests of the many. I've known Jamie since, I'd say, 2018, 2019, and I've heard him speak on a wide range of issues, and I'm really happy that he's joined us today. So I'm going to hand straight over to you, Jamie. Welcome.
Thanks, Will. Um, Interesting title. What is austerity logic? Is that where a mathematician gets as far as 2 plus 2 equals and then can't afford the answer? And I'm not just being satirical. Austerity logic isn't just attempting to justify cutting public services, it is also austere logic. Logic that's incomplete because it lacks the investment of time and energy to reach an accurate conclusion. For example, scrapping the two-child benefit cap would cost around £3.5 billion and lift 500,000 kids out of poverty. Austerity logic frames it as a simple choice. Should we gain £3.5 billion in return for 500,000 children suffering? Austerity logic is the logic of silos, the idea that you can have a small, self-contained policy that exists in its own pocket universe. But of course, real life is not so convenient. For starters, child poverty is poverty. It affects the parents, it affects the siblings. Their mental health is stressed, their physical health is stressed, their educational attainment is impaired. The teachers in the schools find their jobs more stressful. The demand on the NHS, on special educational needs services, on the criminal justice system, they all increase. Personal relationships are strained, parents become exhausted, take time off work, that lowers productivity. And the aggregate effect is huge, and it's never calculated in advance. Now, I'm an engineer by profession, and when you're first looking at a problem, you might use concepts like an isolated system or a steady state system. These are ready reckoners, a quick and dirty way to get to a ballpark answer. But what happens if a professional engineer designs a car assuming there will never be any wear and tear on the suspension or overheating on the brakes? Well, people die. And that's an exact metaphor for austerity, the assumption that you can cut a workforce without increasing burnout or staff turnover. My wife's a GP, and it's very rare that you'll see a GP older than their mid-50s now. One day on call, she had 76 patient contacts. That's more than a checkout operator. That's triage, take a history, diagnose, treat, document. And the workload is so high, they're all leaving, becoming economically inactive. And what disappears are all the little intangibles, like having time to talk to junior colleagues and pass on experience, or having a bit longer to reassure a patient once they've been treated. But if it doesn't appear on a balance sheet somewhere in Whitehall, it gets ignored. So we need to stop having quick and dirty ballpark policies that do not accurately map the real world. We need joined up thinking, and that's why I'm really pleased to be part of Forum 2029, which seeks a serious approach to building better policy that goes beyond headlines and beyond sound bites. So let's start with the money. Yes, let's have a wealth tax. Not just to raise the money, but to make sure our national wealth is invested in a safer, healthier population rather than share buybacks and super yachts. So we must dispel this myth of the household budget. Public spending is not like private spending. If I stop spending, it doesn't really affect my earnings. But in a whole economy, one person's spending is another person's income. If you stop spending, other people stop earning. And if we fund our public services properly, then all the restaurants and all the painters and decorators and everyone else will have more money in their pockets, more secure lives, and they'll pay more tax. And by the way, hiring a teacher on £35,000 a year does not cost £35,000 a year. The government takes £7,000 back immediately in tax and national insurance, thousands more in VAT on the money the teacher spends. More people in work means fewer benefits, and it means when we look after people that they are happier, healthier, and more productive. Educational attainment rises and crime falls. So, policy number one, and I've got three. Policy number one, stop making important what we measure and start measuring what's important. At the North of Tyne, we developed the Wellbeing Framework. It was an aggregate of 53 measures developed in consultation with about 2,000 people in total that looked at real-world outcomes rather than what was convenient to measure. It covered social, economic, environmental, and democratic well-being. Not just health, housing, access to education, but do you have a voice? Are you respected? Do you have access to affordable leisure and green spaces? And while we're on, let's stop reporting GDP. Just stop, cold turkey. It tells us nothing useful and it incentivizes chasing mirages. So, policy 2. About 4 years ago, I wrote a paper called Regional Wealth Generation, and it covered financial mechanisms for devolution, ways to regenerate regional economies without extra taxation. It included concepts like earn back. I had a target from central government to create 1,700 jobs. By the end of my term, we'd created 11,000 jobs, but we didn't get any more funding. Now, in the private sector, if you smash your target by a factor of 6, they throw money at you to scale it up. So I argued that we should be allowed to keep the actual payroll taxes for the first 18 months of any jobs we created. So it became self-funding. And you get the externalities of better health, empowered people, lower crime. They all come for free. But the big point in that paper that I made was called Invest to Save. And I developed this after a conversation with Andy Burnham, who told me about his bed every night policy of ending street homelessness, which cost £11,000 per person who used it. But it saved £21,000 a year in costs for the criminal justice system and A&E admissions. Now, Andy had control of the NHS and the police budgets, so he was able to reduce his costs by cross-investing, and all the moral good came for free. So if we look at something like obesity, Public Health England's figures show that obesity will cost the North East economy £1.7 billion a year by 2050. Our total annual transport budget is a tenth of that at 160 million a year. So if we invested more in public transport, a better service, cheaper fares, people would walk a little bit more every day, which saves us a fortune in long-term health outcomes. But at the moment, there is no incentive for the Transport Authority to save the NHS budget money. Now, I run an arm of government, and I was well known across the board for being on top of the detail and reading everything. But never once in 5 years did I see anything coming out of Whitehall that was even in the slightest bit holistic. And you don't even have to redesign Whitehall to do it. You do the research and develop a peer-reviewed evidence base. For example, in Sunderland in 2016, a project of boilers on prescription worked with people with long-term health conditions. They upgraded their heating, their windows, their home insulation for free. And they found that their homes were warmer, their bills were lower, and it saved a fortune in GP admissions and emergency admissions to A&E. So you now have a price mechanism, not for how much it costs to treat people, but for how much money it saves when you improve someone's quality of life. So as a regional mayor, I would be able to price in the health value of getting 10,000 extra people every day on the regional transport system and recoup that directly from Treasury to fund the investment. I could even borrow money against that income stream. And I could take a similar approach with swimming pools, youth clubs, and so on. So that's policy 2, invest to save. Right, final policy, policy 3. This is about democracy. A big part of the problem is policymakers blindly accept the premise that's put in front of them, that we must reduce the welfare budget or make it easier for developers to build homes. Complex issues are reduced to simple binary choices. These are often ministers making these decisions, passing rules requiring public servants to undertake continuing professional development, yet they do bugger all of it themselves. The worst of them spend their time lining up gigs on I'm strictly dancing in the jungle, get me out of here. Now, not everyone has a background in modeling complex systems or applied social psychology, I get that. But how hard would it be to read a couple of books? As an MP, you're in a perfect position to learn anything you want. If you ask an academic or a think tank for a meeting, they will fall over themselves to talk to you. And I'd be interested to ask the Autonomy Institute or NEF or JRF, how often do MPs come to you asking advice compared to how often you have to chase them for a meeting? Now, I've often said, if you want good health policy, talk to doctors and physios and health visitors. If you want to know how to speed up the buses, talk to a bus driver. They do it 8 hours a day. My 17-year-old son is applying to do medicine. And to even have a chance at an interview, he has to have volunteered at a GP surgery and shadowed a hospital doctor. So policy 3, publish the continuing professional development record of the policymakers with regard to their policy area. And I don't mean some sort of Rachel Reeves dodgy CV. I mean a regulated format of continuing professional development. For example, spending a full day as a teaching assistant in a school with 60% free school meals. And you can be sure that if it's published, they'll be motivated to do it. That way, they spend less time on photo ops and listening to pollsters and more time understanding the real world implications of their decisions. So 3 policies. 1, measure well-being. 2, invest to save. 3, work experience politicians. To start.
Thanks, Jamie. That's wonderful, and I think I appreciate that you went to the kind of I guess the concepts and philosophies of austerity, and then therefore the philosophies and concepts that should drive the alternative. And 3 policies is cheeky, but we'll take them. And to answer your question, obviously only the best politicians come to the Autonomy Institute for their advice and policies. So that's my answer there. Wonderful. Okay, let's move to Abby for something a little different. Abby Jitendra is a principal policy advisor at JRF and is leading on their program of work on care, family, and relationships. I've been talking to Abby for a short while about the future of care, and that's why we brought her in today. I'm very excited to hear about what her thoughts are on what the future of the care system should be, and how that should be part of a program of policies to help raise living standards. Although we have also told her, Abby, that she can speak to wider policy set around public services. Abby, over to you. Jack, I think it's going to spotlight you. There you go.
Brilliant. Thanks so much, and brilliant to be here. I don't think I've got just one policy. Sorry, I think I've got a whole package of them, unfortunately. But I'll try and like brand it in a way that feels that feels more limited. So I'd like to start with a note on trust, because I think we hear a lot about how trust amongst our population is declining rapidly. And politics is often, and politicians are often seen as a key driver of that. And we did some work recently with Professor Jane Green at the University of Oxford, which looked at economic insecurity at the household level. And we found that that is one of the sort of key drivers. So I'm talking about trust, but I'm sort of weaving in care. One of the key drivers there for working age adults is parenting, and the sort of stresses and pressures of care when you are working at the same time. We also found that families or people who experience economic insecurity are more likely to vote reform. And so there's quite a direct link there between having a sort of pessimistic view of the world because of these issues. We also know that trust is declining because of failing public services, and austerity is obviously a key driver of this. So research found that 86% of those who are dissatisfied with the NHS say that the system of government needs to be improved. So there's a really direct link there with a key public institution and people feeling like the country that they live in works. And we also know that there are deeper roots of this. So local government and your kind of lived experience of government tends to be your local government, and councils who run and fund what the average person thinks of as the state now spend 42% of their budgets on adult social care, with per person spend on adult social care up 50% since 2014. And that means libraries, community centres, pothole repairs get pushed out to pay for what many consider to still be a sort of inadequate and underfunded system. So again, another driver of mistrust in the government, a sense that government taxes us too much and doesn't give us very much in return. And this creates a real vicious cycle, because it's a huge barrier to investment in public services, because people don't want to pay higher taxes. They think they're already paying enough. And so investing more in public services becomes even harder. And I think that's one of the main reasons why we are where we are, and why conversations like this are so important. I'm going to focus. Obviously, I've sort of talked a little bit about care, because I haven't just shoehorned it in. I really do think care is a crucial part of fixing care is a crucial part of how we fix this underlying problem of trust in the state. But I'll move now to some specific policy reflections on how I think we can fix care. So I think we need to get three things right. And I would just say I'm talking about care in two forms here: childcare, but also social care and adult social care, and also unpaid care as well, which sort of encompasses both of those. So formal and informal care. And I'll talk in a minute about why I think of those all together. So when we think about formal care services, so childcare, adult social care, I think there are three things that we need to get right. So going forward, so affordability and value for money at the sort of individual household level, but also for the government. The workforce, workers in care sectors are paid a pittance, some of the lowest paid workers in our labour market, and with some of the poorest conditions as well. And then also quality and availability. So what are we paying for? Does it feel like it's a good service? Do I feel like I'm getting, sort of my money's worth? So starting with childcare, where there have been some positive improvements, I think, but there's more to be done. The government, you might know, has it was the last government that started it, and it's been continued by this government, has increased the amount of free or funded childcare that you can get if you're a working parent. And there's definitely more to be done there, including pay for workers still really lags behind, kind of equivalent roles in the education sector. And we also really need to tackle the issue of ownership and regulation in the system. So JRF has done a huge amount of work in this space, looking at the ownership of providers in the childcare system, because we know that 70% of providers in the childcare system are private providers. Many of those are small businesses, woman-led, a few settings, but a growing percentage are run by untransparent private equity, kind of backed providers, where it's very hard to know whether they are going to be financially stable going forward, whether they might suddenly close, and whether we are getting value for money as taxpayers and users of these services. So that's something which government really needs to get a grip on, and any future care system needs to be really cognizant of. And what I've proposed in previous work is that we need a new social contract, really, between government and childcare providers, where we have enough funding to provide a really good service, pay for workers properly, but that should come with really high and ambitious standards on these providers. So I might differ from others on the panel. I don't think, I'm keen to hear from others. I don't think we need to, own every single provider. So we don't need public ownership to have a good system. What we need is proper standards, proper oversight, which we need in a public system anyway. But that's not what we have. We don't have either right now. We don't have public ownership, and we have lax controls on finances, and local authorities aren't empowered to really manage their systems properly to deliver good quality available childcare. And then turning to social care, which is obviously more tricky, and it's been ignored time and time again. But I feel sort of cautiously optimistic here, and I really do think there is a chance to shape it through a truly progressive vision. But I also think it's a necessity. We know that between the 2011 and 2021 census, the population of over 65s grew by 2 million, to make the country the oldest it's ever been. And an aging population is predicted to drive an increase in 2.5 million people living with a serious illness by 2040. So those are quite worrying numbers, and we talk a lot about an aging society, but it is it's kind of, it's streaming towards us, I think, much faster than policymakers would like to believe, and things like a potential 10-year delay to meaningful change on social care through the government's plans, which were announced a few weeks ago, is just really not meeting the scale of the challenge. And so I think we do need to inject some urgency into this debate. So this is a really complex space, and so in the time allotted, I won't be able to go into what I think social care as a public service could look like. But I think the place I would start is, I think we need to look beyond the kind of old model of public services, which themselves are being reimagined. So public services, as imagined in the post-war consensus, are themselves changing. So we have people thinking more about sort of local experimentation. We have a kind of different contract between the individual and the state. There is more of a focus on prevention, which I think can be a good thing. And that there is a sense that given the demography of this country, people living longer, women being in the workplace when they weren't before, that means we need to think about these services in a different way. And so just some sort of brief thoughts on that. I think of those issues that I mentioned at the beginning that we need to get right: affordability, workforce, and sort of quality and design. I think on affordability, we need to find a way to pay for a properly funded service, whilst also improving the means test so that people can pay for more of what they can afford, but can have more certainty around what their care costs are going to be, because currently that is one of the key issues that, if a spouse or a parent needs care in their sort of later years, suddenly you're hit with enormous costs, or the likelihood of leaving work to care, which is also a huge cost. This is going to be difficult. It's really difficult to raise taxes in an environment where, as I said, people don't trust the government enough to give them more of their own money. And so I think this sort of comes back to, we need to build trust in the government through better public services. Again, bit of a chicken and egg situation, but I think smart politics can find a way through it, as it has in the past. Finally, as I said, I think we need to care more about how providers are behaving than whether they're publicly or privately owned. And that, again, means getting a grip on who is running care provision, what are the standards there, what are their finances, are they going to fall and close suddenly because they're owned by a private equity sort of pension fund in Canada, as provision in this country, but also in Australia has in the past. And then finally, unpaid care is really crucial. Obviously, it's in a way it's a hidden public service. Lots of people are taking lots of their time to care for their loved ones when public services just aren't available to do so. And I think that's where we need other systems like the labour market and the benefit system to really provide support where currently it isn't offering it, whilst obviously having better formal care services, so that burden is much more fairly distributed. But I don't think we can design out unpaid care, because as writer and carer Emily Kenway has written before, care needs are lawless, and it's very difficult for a public service to capture that. And so my final thought here would be, there's a lot to do, and as I said, trust is both a barrier and an opportunity. I think another thing that gives me some hope to finish is that actually the politics of care is really nuanced and complex in a way that other social policy issues are not. We actually see cross-party support for care reform, maybe because of the sort of demography of people that vote for right-wing parties, but actually Conservative voters are 10 points and Reform voters 20 points more likely than Labour voters to say social care is the most important issue facing the country. That's from a recent poll from More in Common. We also know, as I've said, that fixing it will help address some of the key drivers of mistrust, sort of insecurity in your working years, insecurity in your later years. And so I think now is the time for progressives to think about how they can own the legacy of care, just as they did with health.
Thanks, Abby. And as you're speaking, thanks so much. That's really, really, really very clear. And as you're speaking, I realized that you had the unenviable task of tackling quite a huge issue in about 12 minutes. And I think actually that's not uncommon for speakers at the Forum 2029, when we have, for example, food, water, energy, tax, work, incomes, all in one panel. So in this case, I think you did really a wonderful job of trying to get those principles down by which you can guide a policy set. And obviously care is such a complex, never mind the fact that we're talking about paid and unpaid care, it's also such a complex issue, as you said, that you simply can't just have one policy to silver bullet it. But I think nonetheless, you really kind of gave a lay of the land to allow those policy directions to kind of develop. And I suppose the next unenviable task is for the autonomy team to try and articulate those. But we have a lot of help, because I think what we're going to try and articulate as part of this, during the articulation, it's going to be drawing from organizations like JRF and all the other wonderful organizations working on this stuff. So it's very much not reinventing the wheel, and we'll be drawing on your work for sure. Thanks so much. Okay, so our next speaker is Anna Coote. Anna Coote is a principal fellow at the New Economics Foundation. She's written widely on social justice, sustainable development, working time, close to my heart, public health policy, public involvement, and democratic dialogue. She was also the project director of the Social Guarantee, which was a project aiming at giving everyone access to life's essentials, very much in line with Autonomy's UBS hub in many ways, a forerunner of that. She's also written the case for universal basic services, someone that we have a lot of dialogue with, and I'm very happy that she's here to join us. So Anna, over to you. Thank you. Oh, Anna, you gotta unmute yourself, Anna. Sorry.
Thank you.
Wonderful.
All right, you can hear me now. Thank you very much. Thanks for having me. Thank you to Jamie and Abby, because they were both great contributions. And I hope what I'm going to say will really endorse and help to put more flesh on the bones of what you've been saying, and put that into context as well. And because it's a sort of a big picture. I'm going to talk about universal basic services. I've got some slides. I'm going to share my screen. I don't think you want to stare at me for the next 10 minutes, so I'll give you some slides to look at instead. And here we go. Hope this works. Okay.
Yes, we can see. Thanks so much, Anna. We can see it. Yeah.
That?
Yeah.
So yes, I'm going to talk about universal basic services, a subject that's very close to my heart, has been for some time now. And I want to impress upon you all that this is not, it's not like a blueprint. It is a way of approaching public policy. And just some definitions to start with. Universal means it's for everyone, not just the poor, when you're thinking about reimagining the welfare system. So it's for all of us. Basic means living well, and not just the bare minimum. It isn't a safety net. And services are not just about public services, but they're about a range of collective measures, of things that we do together that deliver life's essentials. So that's what we mean by UBS. And I'm glad, I think Andrew Percy's in the group there. I spotted him earlier, and he and I wrote a book published in 2020 called A Case for Universal Basic Services, which we've been developing ever since. So there are three main goals here. I hope you will all recognize that diagram. It is, of course, donut economics. Our three main goals are that everyone's needs should be met, not just for now, but for future generations too. And it should be a right and not a privilege or a concession. Secondly, we must save the planet because it underpins our lives. And unless we do that, all efforts to meet people's needs are ultimately futile. So that's important priority. Thirdly, we can only do this by working together through our democratic institutions and through our community groups, because markets have manifestly failed to meet needs within environmental limits. So this program, if you like, is universal, it's sufficient, and it's collaborative. So why do we focus on needs? Needs are what make life possible and worthwhile for everyone. And there's a strong literature on it. It's been very well pinned down through scholarship, but also in public opinions surveys across the decades and across the world, so which basically agree with each other. So we have basic needs, which you can describe as health, critical autonomy, and social participation. And these are universal across time and space. Obviously, how needs are met will vary widely, but there are some need satisfiers that are constant. So that would include water, nutrition, housing, energy, education, care, transport, digital access. And these are what we call life's essentials. And that's what UBS is all about, delivering life's essentials. And a safe, sustainable planet is fundamental to meeting needs. And this can only be done collectively, as I said, and by collective measures, I'm talking about pooling our resources, sharing risks, and working together to help each other. And we want to improve existing services like education and healthcare, and to a certain extent, childcare, which we do have, and social care and housing, but to build new ones or to develop new collective measures where needs are unmet. And you might look there at food, at water, at energy, and transport. So it's about building on what we already have and making it much better across the piece. And you can go beyond those services that are illustrated in that slide. So. Hoping I can move on now.
Oh, sorry, Anna. Are you finished, Anna? Sorry. Oh, there
Yes.
you are. There. Okay.
Sorry, my computer. I think it is a learning project, because what this is based on trying to understand as well as we can what's happened in the past from the post-war settlement, the welfare state, what's worked, what hasn't worked, and what are the essential things we need to bring into this program in order to make it work as well as possible. So we've developed what we call the UBS framework, which isn't a manifesto, it isn't a blueprint, but it's a kind of it's a principled or value-based guide to policy and practice. So it acknowledges that all needs are bound to be met in different ways, but these things can apply in every case. Firstly, universal entitlement, that everyone has a right to have their basic needs met. Secondly, built-in sustainability, so all collective measures are designed to meet climate goals and stay within planetary boundaries. That's a big ask, but it has to be there, because without that, we go nowhere in the end, in the short term, actually, and in the medium and long term. Put people in control. This is a big lesson from the experience of the welfare state developing since the 1950s, that we want to devolve power to the lowest appropriate level and to use democratic dialogue and co-production to develop services that people really need, and to make sure it really does, people feel that they're in control of the services that are going to meet their needs. And you must have fair pay and conditions for service workers, including training and career progression, because if you don't, you won't get the quality services that you need. And like Abby, we support the idea of a mixed economy of providers. So we want to include non-profit organizations as well as businesses and local authorities and national state institutions, but they would be bound by a set of shared public interest obligations, which I can say a bit more about. Now, this would leave the government as a direct provider of services where appropriate, but it chiefly acts as an enabler to ensure equal access to services, to collect and distribute funds, to set and enforce standards, and to support this mixed economy of providers, and to coordinate action across the sectors. And here, there's something that we picked up from the people who've been working around the foundational economy, this concept of social licensing, which is to try to have a regulatory system that says to any provider that includes, that receives public funds, either directly or indirectly, to provide services for the public good, have to sign up to these obligations, which would include the elements that are in the UBS framework. But that's an underdeveloped idea. It needs more work on it, and I hope we can do that over the, as soon as possible. And now I want to talk a bit about sufficiency, because, as I said, it's important that that services have sustainability built into them. So we have this concept of sufficiency, which is about there being enough for everyone, so that everyone can have enough in the future as well as in the present. It's about developing decent living standards for everyone before a floor that below which there is deprivation, and a ceiling above which there is excess. And this, we think, is a useful way of developing services and deciding what we need to focus on and what we should try and phase out or eliminate, depending on how serious it is. So we were looking at this area of sufficiency between the social floor and the ecological ceiling when you're thinking about envisaging and planning and developing public services. And just there, that's in that area is where we see public luxury, that it isn't about just everybody having the bare minimum, but it's about people being able to live well within limits that don't wreck the planet. So that's the basic idea there. I'm going to give one very brief example, and this is, it's frustrating because there's never enough time to explain this in detail, but an example of a transport as a universal basic services would be that it's universal. So it is designed, a transport system designed to meet everyone's needs for travel to work, school, jobs, etc. But it is sufficient. So priority is given to travel for essentials and decent living standards and to end excessive high carbon transport. And that's built into the planning of the system. That it is systemic, that it addresses the whole transport system and how all the different modes of transport connect and how transport connects with other essentials, because it's a very important vehicle for enabling people obviously to access other services and other collective measures that enable you to meet your needs, and to invest early in decent transport for both to try and reap these benefits that Jamie referred to, that you invest in decent public transport system, just like in other public services, and you get a range of really strong social, ecological, and economic benefits if you do it right. So, for example, in transport, if you have sustainable fleets and sufficient services, you improve well-being. You can change consumption patterns if people get into buses and use their bikes more, or are able to walk more easily, then they're less likely to rely on cars. You cut emissions. You're safeguarding finite resources by doing that, and you're generating economic prosperity because people can move around, and you need that for the economy. And we started looking at a consumption corridor for transport. I won't go into detail here, but trying to distinguish between what is essential, what is sufficient, and what is excessive. You no need to try and read that now, but it's there if you want to look at it in the future. And we've also written this up for a paper for the New Economics Foundation, which is published, called Moving Forward. So is it achievable? Well, the thing about UBS, this approach, is that it's a big idea that can start small and local. And then you can build it up incrementally, learning from experience. There are countless practical examples, which we have gathered together in many of the things that we've written from other countries and some in the UK as well, about what it could look like if it was really so, childcare in Norway, social care insurance in Germany, housing in Vienna and Copenhagen. I mean, the list is endless. Free transport in Luxembourg and Tallinn and so on. So there are lots of examples we can draw on. And there's mounting public support for more and better public services, and also a growing awareness, maybe not among those politicians who need to be better educated, but there is a growing awareness that this approach is crucial for achieving climate goals and social justice and a flourishing economy. And I would add that government is already committed to improving key services. So we have a kind of the beginnings of something. I do think it is achievable. It is recognized by the IPCC, the International Programme on Climate Change, who've recognized and are working this up, and we're going to hear more about this summer when their next report comes out, that we need services for provision of public goods, because these are linked to reductions in emission. And there's a growing number of official documents that are clocking that this matters, and this can really make a difference, both for the economy and for society and for the environment. But what about this? The problem is that this does challenge the orthodoxy as it's presented now. And here, I line up with Jamie and what he's saying about austerity and so on. We have a government that has, I don't know whether this is changing now, I live in hope, The government wants to grow the economy first, because that will mean they can then invest in more and better services to meet people's needs. And to paraphrase Bill Clinton, this is just stupid economics, because unmet needs drain the economy so it can't thrive. I'm not going to get into an argument about whether or not the economy should grow, but we need an economy that flourishes and that enables people to meet their needs, that works for people and the planet. The economy depends on people, who in turn depend on decent education and training and housing and utilities, childcare, social care, transport, digital access, and much more. I mean, parks and leisure facilities are really important too. So, and if you have ill health and unemployment and unrealized human potential, this costs billions, which would better spent on enabling people to be healthy and productive. So this is about investing in the social and material infrastructure to meet everyday needs, because it will yield handsome dividends. And funds are available if the political will is there. Through a combination of tax reform and borrowing, it can be done. And if we don't do it, we're in trouble. And the thing is, we can't afford not to do this. I think actually I've missed. Here's just a very brief summary of the gains from investing in universal basic services. It helps to build a healthy, productive population. It cuts carbon and safeguards finite resources. It generates a lot of employment, and most of these are green jobs, because their jobs in services are based on human relationships, not on material hardware, as it were. And it generates more tax revenues and helps to stabilize the economy. I won't go into detail there, but I could. It prevents problems, and this is something that both the two earlier speakers mentioned, that if you give people what they need, you prevent problems occurring downstream that cost much more to tackle. And if services are under public control, they can achieve much better value for money through economies of scale, avoiding transaction costs, cutting excess profit, and they're easier to manage in a sustainable manner. And this approach redistributes resources, so it's a good way of cutting poverty and inequality. Decent services are worth much more to low-income families than to better off families. So it is a redistributive mechanism as well. And it builds social cohesion, because everybody benefits. It's not about just the poor getting it all, just a few people or lots of people not getting. It's about services that are available to people according to need, not ability to pay. And this builds public support for policies to reach net zero. I'm convinced that a lot of the opposition to climate policies, for example, are from people who don't trust the government to have their best interests at heart. This is getting back to what Abby was talking about. It's about building public support. If people think the government is really trying to meet their needs and give them the essentials of life, or enable them to get the essentials of life for themselves, then that will make them more likely to trust in the climate policies and the environmental policies that we must have if we're not going to completely wreck the planet. And we can't afford not to do this, because this is what reform is working on, is appealing to that lack of trust, that sense of discontent. But if we put people first, if we have a priority mission, to use the phrase, that we want to provide decent, affordable living standards for everyone, we can cut the ground from under the boots of the populist far right. And I think this is so important now, that if we don't take this approach, we are really going to lose ground and find it much more difficult to regain the political momentum. So, in a word or two, enough for all, so that everyone can have enough now and in future. That's what this is about. And then, since I was asked, a new progressive policy platform must start with a commitment to meet everyone's basic needs within planetary boundaries. Thank you.
Thanks, Hannah, for a fairly comprehensive look at universal basic services. That was wonderful. Thank you to all three speakers. We have just over half an hour for any questions, and I would encourage anyone to write a question in the chat or raise your hand. And while you think of those questions, I'm going to just abuse my role as chair tonight to ask a question which I think kind of threads through all three of your talks. But it's also quite a tricky one, because not only because public services, can sound like one giant amorphous blob, but I want to get to some specifics really and ask each of you a question which you can take in any way you want. But it's a question around democracy, devolvement, and/or co-production here, because it's partly around, yes, the kind of fraying of trust in society. It's partly around the hugely unequal distribution of resources around different regions of this country, and it's also around the kind of, yes, quality and accessibility of services in general. Of course, it speaks to all those things, but I'd like to hear from each of our speakers around, what is the role of democracy and/or development and/or co-production, the kind of a different way of engaging, perhaps, with those who use services and/or work for those services. And I don't want to make it too loaded a question, because I don't think it's necessarily the case that every service needs to be maximally democratized in all sorts of ways, but I think each speaker alluded to ways in which the involvement of workers and/or users of services could make a difference in how we conceive of them and how they actually run. So pick whichever service and whichever of those three concepts you want to kind of explore. But I think I'll start with Jamie, and we'll go Abby and then Anna. So I'd like to hear your opinions on that, because it is one of the big questions around public services and what they might look like if we had a chance to renew them. Jamie.
Yeah, and it depends to some extent on the nature and scale of the service. If you're talking about something like the East Coast Main Line, that's very different from your local park. But what we did in the North of Tyne is we ran citizens' assemblies and a lot of engagement events. And actually, I gave the policy over to the people. And this was done by sortition, so it was a genuine spread of people, not just those who normally reply to these things, who have an interest either pro or against. And I said, those things that we can do and we have the power to do, we will do. Those things that you recommend that require partnership working, we'll try and work in partnership, but it's not entirely up to us. And those things that are beyond our remit, well, we'll lobby for them. And they came up with a fantastic set of policies, which probably would have been what would happen if I'd sat down with my team and we'd just written them ourselves. So I do actually trust the wisdom of the public when there is deliberative democracy and not just a random tick box on a social media poll, because they had the power to choose their own experts, interrogate them, and get an evidence base. What we also did was co-design and co-produce services as much as possible. And this is very much part of the community wealth building agenda. It's the amount of times that you get as a politician in power approached by big corporations saying, oh, we'll do this for you, don't worry. And you know that primarily it's just going to be extracting wealth from the local economy. So where we could, we would work with local institutions of all kinds, non-profits, a lot of non-profits, but also small independent businesses, and skew the availability of contracts so that it wasn't heavily weighted on how much financial assets you have, and it was much more weighted about the social good that would be done in terms of reinvesting in a local economy. And so with that approach, you get not only lower wealth extraction and more money in the local economy, but you also end up with more diversity of thought. And I think this is actually quite important. Yes, you need the right balance between professional autonomy. And actually, I do believe people in the front line usually know what they're doing. But there does have to be provision for making sure someone hasn't just, read something on the internet and is putting it into practice without any evidence base. And that's the role of regulation.
Thanks, Jamie. Yes, I think that's another way of putting the kind of in a slightly more eloquent way in my question, which is around what's that balance between professionalized, robust, decent services and also, perhaps others having a say in, or at least having some kind of way of co-designing it. Abby, What are your thoughts on any of those three concepts which I've thrown at you?
Yeah, I agree with lots of what Jamie just said. Yeah, I have sort of two contradictory views on this. So using the example of the disability benefits debacle, which has obviously come to a head today, you know, one of the key things which civil society was asking for was for any future disability benefits system to be co-produced with disabled people. And after, you know, months of fighting that and months of you know, criticisms about the design of the government's proposed system, the government has effectively conceded that that is needed and that is now going to happen. So I think that that's a good lesson that, you know, there are many parts of public services that you just cannot get right without co-producing them with people. Equally, I'd say there are other examples where co-production, I think, is used cynically by government to delay. And, you know, to say we'll have another consultation, we'll have another, I think that the Casey Commission on social care, I think there is a risk of that being another avenue where it's kind of like a talking shop. And I do think there is something about having vision and having a really clear sense of what, you know, the balance of risk should be between individuals and the state, and having a really fulsome view of what the state can deliver for people. And knowing that part of the reason why we have the state is because we don't all have time to think about, you know, every single part of our community, what it should look like, parts of public services. For many people, the state is something that they want to take for granted because it just works well. And so yeah, I think that there's a sort of tension there. I think lots of progressives think that most people are obsessed with politics, but most people aren't obsessed with politics. They just want the things that they rely on to work well. And often that is, you know, because politicians have a clear vision and policymakers are good at turning that vision into practice.
Yeah, I suppose that's something which it's fundamentally, you know, I mean, I think it's fundamental, right? So I think people want stuff to just work. And I guess that's something which is not just about a comment on the kind of decaying kind of the public service that we have, which are drastically underfunded and people the workers are doing as well as they can. It's not just saying, hey, we want to work as a baseline, but also just in general, no matter what society we live in, we do if we think about public services, we probably just want them to work well in the background. So you have as frictionless interaction with a lot of these things as possible. It's not just an austere aspiration. It's actually one maybe which is fundamental to the concept. Interesting. Anna, what are your thoughts on those three concepts? It was democracy, development, and or co-production. Would take whichever one you want.
Can't take them individually. I have to take them all together. Sorry.
That's fine too. Yeah.
I think I think there is a real danger, and I think both Jamie and Abby referred to this of you know, bad consultation is really bad because it develops a sense of exasperation and more distrust if it's not done well. So if you're going to involve people, I think, well, let me just say, devolution on the whole, if you follow the principle of subsidiarity, it means you devolve things as far as you possibly can, but for it to be practicable, that's absolutely right. Devolution has to be done hand in hand with a funding system that ensures that the different devolved regions or localities have got an equal share of resources for the problems they have to address and the populations they have. And so there's a critical role for central government to ensure that that is possible. They have to collect and distribute funds among the devolved authorities to ensure that they get enough money, even if they have more tax raising powers of their own, which may also be a good idea, but you don't want poor services in poor areas and rich services in rich areas. I mean, it's just, you know, that, so you have to be careful about that. On democracy, I think I wrote the first paper was ever published in this country on citizens' juries back in the mid-90s, and have followed the whole fortunes of deliberative dialogue and democracy since then. And and I'm a real fan. I think it's terribly important, but it does involve time and money, and you've got to make sure that people are well informed so they can participate properly and, you know, be on an equal footing with the experts who they're engaging with and so on. So you have to invest in this, and the same goes for co-production. I mean, co-production can be a great. We did a lot of work on co-production at NEF about 10 years ago, looking at what it meant, how we could do it, and it is a really serious undertaking. If you're really going to co-produce, it's an equal and reciprocal relationship between the producers and the receivers, or the users or participants of services, and you involve them in some of the service delivery as well, if it goes well. So it's a really complicated. It needs resources. It's got to be done well. And I think we need to be sure. I think both the other speakers made this point. So there are horses for courses. Some decisions are better made at a national level. Some decisions really can only be made by the people who are going to benefit from the decisions that are made, or just so local people. But you've got to support it centrally. You've got to support it with enough knowledge. Make sure that it's not done badly. So I suppose that's a question for regulation. So yeah, we need it, but we need it to be really high quality and to really be certain we're not using it as a way of just shifting responsibility. I also remember the big society. I don't know how many people remember it, when David Cameron tried to say everything was going to be done locally, and he was just basically just trying to shift responsibility from government to communities, so-called, and it was with a toxic policy, which sounded really nice and cuddly, but it wasn't. It was very dangerous. So lots of caveats, but basically important to get it right and important to sort it, to support it. I mean, people need community spaces, right? Just for starters, how can people run their own affairs locally if all the community halls and meeting places have all been shut down because there are no funding? Just that's number one, you know. And then they need access to the input. Sorry, I could go on.
No, yeah, no, and I'm going to go to Julian in just a second. I think there's. I mean, I just want to quickly note that for some reason, I mean, not for some reason, for good reason, the big society haunts all these conversations about almost every policy that I talk about. Everyone at some point brings up the big society, like it's like as the kind of spectre haunting all good policies. Is just don't forget that the big society policy, where effectively no resources were given, and yet an expectation that kind of the human spirit will kind of carry us forward. So it's always good to remember that didn't work and was rubbish. So thanks for bringing that up, Anna. I'll pass to Julian, who has a hand.
So Anna just brought up community spaces, which is sort of has to do with the question that I wanted to put first to Abby and then to Jamie, maybe around the material, what Anna has referred to as the material infrastructure necessary to deliver services. So I'm wondering what the role has been in your thinking, Abby, when it comes to space and material infrastructure. And then maybe hear from Jamie some thoughts and experiences around that aspect.
Thanks, Julian. Abby?
Yeah, thanks so much. So was that about thinking about this kind of space around public services?
Yeah,
or...
I guess we've done some thinking around the role of space in social care, and we think it is maybe the site also to negotiate the lawlessness that you referred to when you referred to Emily's words. and maybe the role of the high street. But it's obviously very sort of sticky aspect of it that also has a lot to do with that sort of big society imaginary. So it's a difficult one and one to get right. So I'm just curious about.
Yeah, that's really helpful. I actually visited a care home last week where the sort of residents kind of homes are co-located with a nursery, and so like little kids like run around during the daytime, and these like quite sort of profoundly disabled or yeah, people who have dementia actually have like get so much joy from kind of sharing space with this really lovely kind of other service. So yeah, which leads me to think, I think we can use space in much more like novel and innovative ways. I think the key issue though, as like, my work and the work of JRF, we tend to think about kind of the material in the sense of like, do we have enough money to pay for it? What are the sort of policy frameworks? And there are others who do a lot more on, what should the design of services be? What does like good look like? So we tend to defer to them. But I guess the thing I'd say is the setting that I visited is a charity, and it's also really embedded in a particular community where a lot of legacies and individual donations mean that they have a huge amount of money to subsidize those that can't afford it, and that kind of provision is really expensive. And so yeah, it sort of comes to, I think realistically, I don't think everybody is going to be able to have, a perfect system. But we need to move towards at least the basic minimum being much better, and ensuring that we don't have effectively what we have, a sort of two-tier system now where you have people at the sort of bottom of the income distribution not having much choice, and people at the top having a lot more choice. Yeah, I don't know if that's a very good answer, but those are my first thoughts.
Thanks, Abby. Jamie, and the importance of space and material infrastructure for public services.
Yeah, I think Julian's implication that space affects our psychology and about everything we do is absolutely bang on. You've only to think of what the typical default serious punishment is in almost all societies. It is to deny someone freedom of space. We lock them away. And then solitary confinement is the really serious one. And if you think about what that means for someone who isn't incarcerated, yet there are many people who are effectively imprisoned in their homes. Even, if we take aside extreme poverty or health conditions or anything like that, for an awful lot of people, if you live in an area where there is nowhere you can go without having to pay, you are now trapped in your home. And this was an issue. We had a Citizens Manifesto event just on Sunday, and a number of young people were talking about the fact that there is nowhere you can go where you don't have to pay. So yes, you can go and talk to your friends, but you have to buy coffee, and they haven't got any money. So the other component to that is spatial access. So even if there are some places you can go, if it's a 20-minute bus ride and you've got to pay the fare each way, then it's not really that accessible anymore. Especially, around here, there's whole swathes of County Durham where there are no buses after 6 p.m, literally just none. And so, again, that infrastructure is denying people. There was a major project that I funded, one of the first big ones I did, there was a derelict youth club that had been near St James's Park, funnily enough, in Newcastle. And someone had a plan for years to redevelop it, but they couldn't get the money together. And they obviously wanted a huge sum of money from us, and it would have blown half my budget. So what I said was, well, I will put £2 million in, and that will give you the leverage to go and talk to the football club, to go and talk to Newcastle Building Society, to go and talk to the Premier League. And as a result, they raised the £11 million and created this fantastic sports centre with a rooftop pitch and everything else like that. And it gets such use, right down to the Asian elders community playing walking cricket on an evening. But keeping it viable, there's we funded, and others funnel through it, a lot of the public service delivery. So things like adult literacy services, like employability services, in this beautiful building, which then becomes a community hub. And we made sure that there's a fantastic computer room, and then when it's not being used for its public service delivery, the local kids can go in there and they get to play on a really good computer because they can't afford them at home. And that's the sort of thing we should be doing. That is exactly what Anna was talking about when she said public luxury.
Yes, excellent. I'm going to go Jack. Thanks, Jamie. Going to go Jack for the next question, just because he can say it out loud. I don't know if Kyle, you're there, or I can read your question out. But we'll go Jack first, then I'll read Kyle's out, or maybe Kyle can read it out. But go on, Jack.
Brill. Thanks for the panel. That's been really, really interesting and responses. So, is my question, possibly taking up the mantle of Luke, who hasn't been able to join us today, is to, I suppose, ask about or sort of bring into a frame the fact that obviously public services in the UK are devolved policy areas. So, in a sense, we're talking about something which is covered by different governments in Scotland, Wales, Northern Ireland, and also in some respects local governments. So I guess on one side, I'd be interested if people are interested in sort of policy experimentation already by more progressive political forces outside of England, and what if there are any interesting examples or sort of green shoots or something different that people might be interested in that can be built upon. I guess the second one is, I guess, relates to that first question that Will posed about, actually potentially even sort of within England or at a more local level across the UK, what other forms of sort of devolution and subsidiarity of these policymaking areas might unlock some potential benefits.
Is that to everyone? Yeah. Anyone who wants to pick that up? Who wants to go first? Wait, Anna. How about Anna this time? Go first, and then we'll go. Then Jamie put his hand up as well. So.
Yes, just to say that we did something that we published through NEF, which was a compilation of local action. Actually, we published it at the Social Guarantee, which still has its website, although it's closed we've brought it to a successful conclusion as a project. It still has its website, and there's a portfolio of local examples, which I'm sure lots of other people could add to. But these are examples of things that are going on mainly in the UK. There are others that we mentioned in the book that Andrew Percy and I wrote that are in other European countries and beyond Europe. But this portfolio is a useful resource, because people say, well, what do you mean? What would it look like in practice? So you've got all sorts of examples there in the different areas of need. So, childcare, housing, energy, transport, and so on. So if I can find the link, I'll put it in the chat, but if not, I'll send it to you afterwards.
Thanks, Anna. Jamie?
This is, it's obviously what I was doing for 5 years, was arguing for this and renegotiating the devolution deal. And we did get the government to agree to fiscal devolution, and then because I didn't win the election, no one's pursued it, which is actually just such a huge loss for everybody. It's worth, I think, framing this in the sense that the only people who really have power over monetary policy and fiscal policy is central government. Everyone else in Britain's constitution, such as it is, you might get an income stream, but Parliament can take it away. That is very different from somewhere like Germany, where it is actually called the basic law, that different geographical strata actually have enshrined in their constitution the right. The United States is another one. The clue's in the name. They are United States. They have tax raising powers. They have asset ownership powers. But if we look at something like transport, this is absolutely something that should be devolved, not least because the control of the bus service and the rail service should not be in different government departments or sub-departments, or a quango in the case of National Rail or Railtrack or Great British Railways as it may become, because people don't make their decision based on their particular vehicle they're in. They base their decision on the going from A to B. And so public services should always follow the user experience. Likewise, primary care, hospital care, social care afterwards. At the moment, they don't really talk to each other terribly well. And it works a lot better if you actually have these integrated systems. So how do you do that? I negotiated powers for transport for the Northeast. And one of the things that would cost it and leave it in was getting the entire system into a single network, and then negotiating powers, which I may have succeeded, I may have not, but things like salary sacrifice. So at the moment, you can get salary sacrifice for childcare, you can get salary sacrifice for a bike to work. You can't get salary sacrifice for a season ticket on public transport. And had that argument with Treasury, and they said, well, we see this as deadweight. People are going to buy these things anyway because they need them. And I said, you're looking at it all wrong. For anyone who doesn't know, salary sacrifice, if you spent £1,000 on something, it's as if you've earned £1,000 less and you get your £200 tax rebate. I said, you should look at that, not as costing £200. You should look at it as levering in 400% on public expenditure. Because people are then putting money into this system, which makes the whole system more viable. And if it's not a series of random private providers, but an integrated system, the whole thing becomes more viable. Now, I could talk about this for hours, and maybe we'll do it another time. But yeah, and I definitely would like a conversation with Anna about the total transport network, because everything she's saying is right. But I'd also worked out a plan for how you can deliver it without having to raise taxes.
Thanks, Jamie. Okay, there's just over 5 minutes left. I'm going to give panelists the choice, because I have a question. Again, I'm abusing my position here, but I do think there's choice of two quite different questions. One question is from Kyle there in the chat, which is around what's your kind of, let's say, I mean, Abby made the point that in some cases, particularly with the care system, there is a public financing and stuff is hard, and so on, and some cases it might be much easier. So there's one question from Kyle, which is what's your go-to for how to raise money for these things? And then all three speakers alluded to this, but I guess just nailing down, what's your go-to for raising money for this? Is it wealth tax? What else? And I'm broadening your questioning out here a bit, Kyle. The question I had, which I thought also, which you can pick up on, and for all three speakers, of course, is really around the interface with these services. So kind of zoning in on the experience of these services. And this is something which I think gets lost in policy discussion quite a lot, where often we speak in bullet points and we kind of think about the kind of often either the numbers or the kind of, let's say, even just the broad policy design. I want to think about the experience of these services. So the question is, and this is both utopian and also about the kind of affects of that experience. What would feel different about a public servant? What would feel different about a public service if we woke up in the world that you would envisage for public services? So your specific vision, how would it feel different? And it can just be, and I'm looking here maybe for just a kind of almost a kind of it could be quite a pithy answer. It could be something which just kind of gives an impression of what would feel different about these public services. And I think that speaks to this question of trust, which Abby raised. And I think it speaks to the question of the kind of the political constituency that we're also trying to speak to here. So take either of those questions. It's the last final little run through the speakers. So it's either or both if you want, but there's a question about kind of taxation and funding this stuff, and also the kind of experience and what would feel different in your new world. Let's start with Abby. Sorry, Abby, I'm picking on you first.
No, that's great, and two really good questions. I might just briefly try and answer both of them. On what would feel different, I guess I'd hark back to my previous point around, services feeling easy. In a way, you don't want to turn public services into customer service, but I think many of us, if you need to get a GP appointment or if you need to call the local council about something, you just sort of gear yourself up because it's anxious. You know that it's going to be really difficult. It's going to be labyrinthian and it will be hard. And I think that's it really contributes to a feeling of sort of broken Britain. That's one limited example. There are like so many more, but I'm referring to one that I think we can all probably think of, has happened in the last sort of couple of weeks. So I think that's the thing that would change, a sense that it's easy to access, support is easy to access. And Hilary Cottam has done lots of really brilliant work on this, a sense that it shouldn't be defined by scarcity, but by availability and abundance. Obviously easier said than done, but I think we've talked about several ways in which we can do that in this discussion. And then on taxes, I would just sort of, a note of caution, we talk about wealth taxes a lot in sort of progressive circles. They're extremely unpopular, and so we need to think about how to sell them. There's lots of work going on this, but I think it's used too easily. It's not easy, it's really difficult. Taxes are hard, wealth taxes are even harder. Inheritance tax is one of the least popular taxes there is, and any government that wanted to stay in power wouldn't seriously be thinking of doing those in without priming and framing and setting out what the vision would be in order, like why do we need that revenue to be raised. So that's just a brief thought. There's loads behind that and lots of brilliant work on how we do sell it, and obviously we need to sell it because wealth inequality is enormous, and we have it's called the Great Transfer or something like that, which is happening from sort of baby boomers down in a very unequal way, but it's much easier said than done, I'd say.
Thanks, Abby. Good word of caution. Let's go Anna, and then we'll end on Jamie. And thanks, Andrew. Check the chat, everyone, for Andrew's answer. Andrew, one of the audience members, Percy's answer to the experience. We'll go to Anna first, then Jamie.
Yes, I just want to say that I remember in the run-up to the 1997 election, we had the phrase education, education, education. This was the byword. And now we've got growth, growth, growth. And what that tells me is that we're telling ourselves a very different story. I mean, lots was wrong with the politics of 1997, but and the ensuing years. But so this is all about the story that we're telling ourselves. What is it going to feel like? Will be entirely dependent on, first of all, whether it's done well, and secondly, whether we can build up a story, a narrative. I hate these words, but it is about what we're saying to each other about it. And I think that if people felt secure, and it's a bit like Abby said, that it's easy for things to happen. I mean, I travel around London easily because we have a brilliant transport system and I can get anywhere I like, and it's not expensive, and it's easy. And I would like that feeling that things can be negotiated easily, which makes me feel secure about being able to get from A to B for whatever purpose. And everybody else, I would like to feel that way wherever they are in the country. And I'd like that to be the feeling that things are every day. They're mundane. We take it for granted, get to the point where we take it for granted, but that we're telling ourselves the story that this is for us. And if we don't do this, there are all the dangers associated with it. And as for where is the money going to come from? I mean, this is, we very happily borrow money to invest in the material infrastructure, and this is the social infrastructure, and we've got to wake up to the fact that the social infrastructure is as important as the material infrastructure, and that we are investing to save, and that is something we can borrow for, because we do get it does yield really strong dividends. So I think borrow if we can't tax as well, and stop spending money on things we shouldn't be spending money on.
Thanks, Anna. That creates a nice kind of synchronicity with the invest to save mantra that Jamie gave us. So I'll go to Jamie to finish.
Thanks. Really good question. So anything we can actually do, we can afford, is the reality of it. Governments have a whole range of fiscal powers and monetary powers that they can deploy. The reason you need to tax the rich isn't because it's the only way of getting money. It's because it is massively unbalancing the economy. When there's that much money out there, it seeks opportunities for investable propositions, and then they tweak regulations so they can do things like buying up all the care homes, which then knacks all the local council finances. So it's about actually shifting things as much as it is raising money. But in terms of wealth taxes, there's actually a whole slew of things. At the moment, if you are making huge sums of money off, say, the increasing value of the £100 million worth of shares you own, you only pay 24% tax. Whereas if you are someone who is a high earning lawyer, doctor, whatever else it is, you are paying 40% tax. So why is it that we tax work more than we tax unearned income? So that's something we absolutely have to shift. And then when we look at wealth tax on assets, again, we already do that. We already have inheritance tax, which everybody is theoretically subject to if their estate is that large. But it's a random tax at the moment, because if you plan up to 7 years before your death, you don't pay it. So one of the reasons people are so angry about it is it's only the people who have unexpected deaths whose families have to pay it. So it's almost like punishing people twice for being unlucky. Whereas if this was just on a common keel, it would work. And the one thing above everything that unites people on tax is they hate other people dodging it. And that's what winds them up. So if you had a way where everybody paid it evenly, actually, it wouldn't be as bad. So on public services, what would it feel like? We did a lot of work with people co-locating them so that you don't go to one person, particularly people, the most vulnerable people, one person for mental health, another person for drugs, another person for probation, another person for housing. And they go from pillar to post and they miss a lot of the appointments, and that is wasteful in and of itself. We co-located them frequently around food banks. And what that had the advantage of is that people felt they were dealing with someone who understood them. And the reciprocal became true. They felt bad about letting that person down. And it's the old JFK, ask not what your country can do for you, ask what you can do for your country. But it makes people value the public services and not frivolously cancel appointments as well. That's really where I think we need to end up.
Thanks, Jamie. And on that note, I will end this call. Thank you, everyone. We're 3 minutes over the time, so I appreciate your patience. I think it's been actually a really good discussion, and I think there was a risk that when you have a discussion about public services, it is too wide-ranging. But I think we managed to kind of go down a couple of avenues, which helps kind of flesh out the challenges, the risks, but also, yeah, I mean, some pretty concrete ideas about where we need to go with it. So I want to thank our speakers. Thanks so much for joining us on this evening. I think for those based in everywhere, I think there's heat wave. I think we're all pretty happy the heat wave's over, and I'm enjoying this kind of very cool hotel room actually. Enjoy your evenings. Have a good rest of your week, and we'll be uploading this later. And please come to the next Forum 2029, and we'll hopefully we'll be discussing media, tech, and democracy, and how those need to be reformed if you want any of these policies to be enacted. There's a huge blockage. Huge democratic deficit that we have. So look forward to seeing. That's going to be in person actually in Bethnal Green. So please do come to that. Thanks everyone. See you soon. Bye bye.